Irritable bowel syndrome, IBS, is a functional digestive disorder of which there are several subtypes. In addition to abdominal pain and bloating, some people may experience diarrhea, IBS-D, constipation, IBS-C, or a mixture of both, IBS-M. IBS can also be categorized by the conditions that trigger IBS symptoms, including infections and diverticulitis. Although the exact cause of IBS is unknown, there are effective treatments that can help alleviate symptoms. These include changes in diet, fiber supplements, stress management, and both over-the-counter, OTC, and prescription drugs. Irritable bowel syndrome, IBS, is a chronic function digestive disorder characterized by gastrointestinal pain and changes in bowel habits. Symptoms can persist for years, ranging from mild to severe. IBS can be broadly categorized in two ways: by their symptoms and by their etiology, underlying cause. These features can help direct the appropriate treatment and even aid in predicting the likely outcome, prognosis. There are three distinct subtypes. Constipation-predominant IBS, IBS-C, is the subtype of IBS in which you experience more days of constipation than diarrhea. By definition, you have IBS-C when more than 1/4 of your stools are hard or lumpy, less than 1/4 of your stools are loose or watery. Diarrhea-predominant IBS, IBS-D, is the subtype of IBS in which you experience more days of diarrhea than constipation. By definition, you have IBS-D when more than 1/4 of your stools are loose or watery, and less than 1/4 of your stools are hard or lumpy. IBS with mixed stool pattern, IBS-M, is the subtype in which you alternate equally between bouts of diarrhea and bouts of constipation. By definition, you have IBS-M when more than 1/4 of your stools are loose or watery, and more than 1/4 of your stools are hard or lumpy. IBS-M is also sometimes referred to as IBS with alternating stool pattern, IBS-A. IBS is also sometimes categorized by the conditions that trigger it. In cases like these, the underlying cause will need to be treated in addition to managing IBS symptoms. Post-infectious IBS. Post-infectious IBS occurs after an infection in the digestive tract, such as food poisoning. With PIIBS, IBS symptoms can persist even after the infection clears. Post-infectious IBS is characterized by the sudden onset of IBS symptoms. It is diagnosed when you have a positive stool culture confirming an infection accompanied by at least two of the following symptoms: fever, vomiting, or diarrhea. After the infection clears, a person may experience IBS-D, IBS-C, or IBS-M for months and even years. However, with PIIBS, IBS symptoms almost always resolve on their own over time. Post-diverticulitis IBS. Post-diverticulitis IBS is similar to PIIBS in that it occurs after the onset of a digestive disorder known as diverticulitis. Diverticulitis occurs when abnormal pouches in the intestines, called diverticula, suddenly become inflamed, most often due to an infection. With post-diverticulitis IBS, symptoms of IBS can persist well after the underlying infection has cleared. Post-diverticulitis IBS is diagnosed when diverticulitis is confirmed, usually with a CT scan and blood tests, and IBS symptoms persist well after inflammatory markers in your blood have normalized. Unspecified functional bowel disorder. Unspecified functional bowel disorder, FBDU, is when your symptoms do not meet the strict criteria for IBS-C, IBS-D, IBS-M, or any other functional digestive disorder, but still causes bouts of IBS-related symptoms. For instance, a person may undergo a sudden, unexplained bout of abdominal pain with diarrhea or constipation that clears but then reoccurs years later for no known reason. After extensive investigation, excluding all other possible causes for your symptoms, FBDU may be diagnosed. IBS symptoms can vary from person to person and change over time. Symptoms often come and go with no distinct pattern. Aside from diarrhea and constipation specifically, all subtypes are characterized by abdominal pain, changes in bowel movements, bloating, a feeling of incomplete bowel movements, mucus in stool, excess gas. IBS is a type of functional digestive disorder in which communications are disrupted between the brain and the gastrointestinal tract, known as the gut-brain axis. The lack of coordination between the intestine and the brain causes the digestive tract to malfunction in different ways. With IBS, this can cause involuntary muscle contractions of the intestines, known as peristalsis, to speed up, slow down, or become erratic. When peristalsis speeds up, there can be cramping and diarrhea. When it slows down, there can be cramping, constipation, and bloating as food delayed in the colon starts to ferment. Experts aren't sure of the exact cause of IBS, though they suspect a combination of factors may contribute, including genetics or having a family history of IBS, gastrointestinal infections, food intolerances or sensitivities, chronic stress, mental disorders such as anxiety, depression, and somatic symptom disorder, small intestinal bacterial overgrowth. The treatment for IBS depends on the predominant symptoms you are experiencing. Some of the treatments for IBS-C and IBS-D can overlap. As a general rule, all IBS subtypes benefit from certain lifestyle changes, including identifying and staying away from foods that trigger IBS symptoms, drinking plenty of fluids, which helps ease constipation and prevent dehydration with diarrhea, exercising regularly, which helps normalize peristalsis, getting enough sleep, which normalizes circadian rhythms and helps keep you regular, managing stress with meditation, yoga, exercise, and other practices, eating an appropriate high-fiber diet, treating IBS-C. With IBS-C, you can benefit from eating foods high in insoluble fiber. This is the type of fiber that attracts water, softening stools, and moving faster through the digestive tract. Wheat bran, vegetables, and whole grains are rich sources of insoluble fiber. You may also want to avoid gassy foods like beans and cruciferous vegetables, such as cabbage, cauliflower, broccoli, and Brussels sprouts. When you have constipation, these can ferment in the colon and cause bloating and gassiness. Treating IBS-D. With IBS diarrhea, you may need to focus on eating foods high in soluble fiber. This is the type of fiber that turns into a gel when exposed to water, helping bulk up stools and ease diarrhea. Oat bran, barley, nuts, seeds, beans, lentils, and peas are rich sources of soluble fiber. That wraps up our deep dive into irritable bowel syndrome, IBS, its types, symptoms, causes, and treatments. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more health-related content. Have you or someone you know struggled with IBS? Share your experiences and tips in the comments below. We'd love to hear from you. And remember, gut health is key to overall well-being. So take care of yourself, listen to your body, and keep making informed choices. Thanks for watching, and see you in the next video.